Drug resistant is generally defined as somebody who's been on 2 or more appropriate anti-epileptic medications, and those medications have failed to get the epilepsy under control. So that child continues to have problematic seizures despite those trials of 2 or more medications. And I think the ketogenic diet is certainly a very valuable treatment option for patients who fall into that category. Typically we're thinking, are they potential surgical candidates? If they're not good surgical candidates, I think the ketogenic diet has a really useful potential benefit. But I don't think that we always need to keep it just for the drug refractory cases. I think we understand now that there are certain specific disorders, diagnoses where ketogenic diet is first line, and that's some of the metabolic conditions like glucose transporter deficiency. Ketogenic diet should be first line in those patients. And then many of the early onset epileptic encephalopathies where we know the chance the medication's working is going to be fairly low, or others where we know that they really do have a really nice response to the ketogenic diet, like myoclonic atonic epilepsy of DUSA. I think that we should actually be entertaining ketogenic diet earlier, maybe even first line for those children if the families are in agreement. So looking at outcomes of the ketogenic, I can talk to you about epilepsy outcomes. And when we look at children with epilepsy, and as we talked about children with drug-resistant epilepsy, once children have been through, tried on 2 appropriate medications, and those medications have not worked to control the seizures, the likelihood is that the next medicine, the 3rd or the 4th or the 5th or the 6th medicine, probably a less than 10% chance of that medicine working to stop the seizures, to control the seizures. When we look at the ketogenic diet, we actually see that about 15% of children can become completely seizure-free on the ketogenic diet. About another, so if we look overall, about 2/3 of those children can have a significant reduction, a greater than 50% reduction in seizures, so a big benefit for their epilepsy. But also for many of those children, a big benefit for their learning as well. They are brighter. We can often reduce many of the medications that they're on. So many of these kids come to us, they're on 3 or 4 medicines at high doses. If we get a nice response to the ketogenic diet, we start peeling away those medicines and we really start to see that child's personality come out. So that's I think, another huge benefit for the ketogenic diet.